Thank you all for joining us this afternoon. You are attending the CSAC Master Plan for Aging webinar. First, I'd like to introduce myself. I am Supervisor Jeff Griffiths. I'm a supervisor in Inyo County, California in the Eastern Sierra. We're getting a little bit of weather right now, so the moisture's nice. I am the chair of the CSAC Health and Human Services Policy Committee, and I'm excited to be moderating this panel for the Master Plan of Aging. We've been hearing about the silver tsunami coming in California for quite a few years, and over the past 2 years, the governor's administration has been leading an effort to develop a California Master Plan for Aging, and it was released this past January. CSAC and counties were significantly involved throughout the Master Plan stakeholder process and development, and this plan represents an important opportunity for everyone involved in aging programs and policies, including counties, to collaborate and make significant progress. We have known about this coming issue for quite some time now, but certainly the COVID-19 pandemic has highlighted how important this work is and why we need to move forward with urgency. Counties play a critical role in ensuring the health and well-being of older adults in our communities, and I know we are all excited to learn more about this master plan and partner on its implementation. I know that in my experience in Inyo County, which is a remote, rural, sparsely populated area with a high population of older adults, we have challenges that are unique to other urban counties that I've heard to, and how they care for our aging population and deliver services. So we are fortunate today to be joined by several speakers who are directly involved in the development of the master plan and are statewide leaders on aging issues. So I will introduce them. First, we have Mccoy Wade, who is the director of the California Department of Aging, which administers programs that serve older adults throughout the state. She most recently served at the California Department of Social Services as the CalFresh and Nutrition Branch Chief, where she led the expansion of CalFresh food benefits to older adults and people with disabilities. And she previously served as a consultant to multiple health and human services nonprofits as executive director of the California Association of Food Banks. Next, we will be joined by Elizabeth Fuller, who is the chief consultant for the Assembly Aging and Long-Term Care Committee, which has jurisdiction over bills introduced in the legislature related to aging. She previously served as a consultant for the Legislative Women's Caucus, and the Assembly Aging and Long-Term Care Committee is chaired by Assemblymember Nazarian, and she works closely with the chair on aging issues, including the Master Plan for Aging. Next, we have Shireen McSpadden, who is the executive director of the San Francisco Health and Human Services Agency Department of Disability and Aging Services, which coordinates services to older adults and adults with disabilities. Shireen has more than 25 years of experience developing policies and services to help ensure San Franciscans thrive as they age. She is a board member of the California Association of Area Agency on Aging and is an alternate board member representing California for the National Association Area Agencies on Aging. And finally, Keith Prindiville is the executive director of Justice in Aging, a national nonprofit legal advocacy organization that fights senior poverty through law. He's a nationally recognized expert on Medicare and Medicaid policy and has served as counsel in several class action lawsuits protecting low-income seniors' access to public benefits. The author of numerous articles, reports, and briefs, he frequently testifies before legislators, presents at national conferences, and works closely with both federal and state regulatory agencies. So on this webinar, each panelist will provide a brief opening presentation, and then we will move on to some moderated questions and answers, and perhaps some moments for questions from the audience. Don't be afraid to throw questions into the Q&A section at the bottom of your screen. So let's start with Mccoy Wade, who will provide an overview of the Master Plan for Aging and implementation steps. So take it away, Director Mccoy Wade.
Good afternoon, everyone, and thank you so much, Supervisor Griffiths and CSAC. It is great to be back with you all. I remember being with you pre-pandemic at the library gallery, and we were just getting off the ground with this effort, and of course have been working with counties and with CSAC all the way through this process. So it's wonderful to be here with you March 15th, I have to acknowledge, is the 1-year anniversary of the stay-at-home order for older adults that changed so many of our lives. So great to be looking forward, even of course, as we continue to respond. So let me start with that. Next slide, please. Of course, the major priority right now for all of you and all of us is vaccines, and we continue to work hand in hand with counties and other partners to make vaccines accessible. So mainly thank you to all of you, especially today as we're rolling out to adults who are 16 to 64 with high risk medical disability conditions. Thank you for all you're doing to help us get to this incredible life-saving and life-changing moment. But of course, next slide, the past year, we have been working very closely on staying home to save lives and check in. Thank you, thank you, thank you to counties for all the work you did to help get information out to your older adults, to help get food through our Older Americans and Meals on Wheels and Great Plates, to help with housing and homelessness, Project Room Key and Home Key, of course, and dealing with isolation and mental health, and hopefully promoting the Friendship Line and other call in and check-in campaigns. So just gratitude for all the partnership that we have, extraordinary truly, that we've had to muster, and hopefully again are here at the dawn of spring, moving into a brighter day. And that's really where the master plan comes in. Next slide. As you well know, we started before the pandemic, but are deeply informed and fueled by the pandemic experience. So the master plan, after 18 months of work with hundreds of stakeholders, was released on January 6th with the governor's team and our secretary and our stakeholders and partners from the legislature was announced. And it laid out 5 bold goals for 10 years, which we'll talk about in just a second, and I hope resonate deeply with you. But first, let's start with the why. Thank you to Supervisor Griffiths being aware of the demographics. Let me share a little more on that front. Next slide. As you all probably can already see from your Board of Supervisors perch, aging is changing, and it's changing California, and it's changing your county. First and foremost, Californians are living longer than ever before. We have one of the highest life expectancies in the nation. Now, we have to update this tragically with the loss of life, particularly in Black communities, Latino communities, and some South Asian communities. So there will be shown in our, of course, in our data and in our families and our communities and our hearts, a change in this trend due to COVID. But over the long haul, life expectancy continues to grow, and people live to their 60s, 70s, 80s, 90s, and even 100. Next slide. This is also changing in relation to children. Again, as you look at your county demographics and county budgets, in 2010, there were more 0 to 18-year-olds than 60 plus. But by 2030, 60 plus is going to exceed 0 to 18 and continue on that way. So what does that mean for your parks? What does that mean for your schools? What does that mean for your emergency services? What does that mean for your social services? All the critical services that counties provide as the demographics of who you're serving is changing. And thirdly, next slide, of course, older California, like the rest of California, is diversifying. So the oldest part of our population has been the slowest to reflect the growing diversity in California, given demographic trends. But as we diversify our older California, it has tremendous implications in terms of the cultural traditions around aging and the family traditions around aging that are changing, around culturally competent and language services. We do have a high number of older adults who speak a language other than English, and it's often other than Spanish, frankly. And so how do we make sure that the services we have are where people need them to be in the way they need them to be? And again, the vaccine rollout is giving us all a crash course in accessible and trusted services to older adults. Next slide, please. So against that demographic background, we went out and listened, and we had an enormous number of stakeholders. I'm so glad Shireen, McSpadden, and Kevin Prindiville are here because they were part of that process. Lots of roundtables, including with Assemblymember Nazarian, whose staff member Liz Fuller is here, partnered with Maria Shriver's task force on Alzheimer's disease prevention and preparedness, and had a full cabinet work group. We started with part of the cabinet, but as we got momentum, every single member of the cabinet came on, food and ag, corrections, whole cabinet work group, and then of course, deeply influenced by COVID, including record-breaking meals in places like Ventura and San Francisco, room key and home key, and so much more. Next slide. I want to particularly shout out and thank all the counties who were critical leaders in this. This is only a snapshot, but Catherine Barger, Supervisor of Los Angeles, was on the Stakeholder Board of Supervisors, and we were very lucky to have presentations from LA County on their Purposeful Aging Initiative and San Diego on Age Well. San Diego both came to the full stakeholder committee. And then we started a Wednesday webinar series and to do deep dives on various aging topics, and we frequently featured counties. San Diego on parks and intergenerational engagement, Monterey on adult protective services, Sonoma on emergency and disaster preparedness, Contra Costa on transportation, Santa Cruz on isolation and their really groundbreaking We're Still Here art exhibit, Ventura County on falls prevention, and more. So knitting all that together, next slide, we landed on this framework influenced by all of that input from the counties and the cabinet and stakeholders of 5 bold goals for 2030 that we hope resonates with you in your county, whether you're in Inyo or Los Angeles. Goal number 1, housing for all ages and stages. No surprise that housing is one of the primary issues. And again, as we age, different housing makes sense for us and our families and want to have that full range of options. Goal 2, health reimagined. Wanting to make sure that health services can support us at home and in the community. We can address dementia, address nursing homes, and make sure our workforce is ready to deal with geriatrics expertise and services. Goal 3, inclusion and equity, not isolation. So much to be done to really include people of all ages, all races, LGBTQ, all immigration statuses, and more in our full fabric of community life. Caregiving that works, family caregiving and paid caregiving is essential to successful aging, and we have challenges on all fronts there that were worth highlighting. And I don't need to tell you all as county leaders affording aging, both the food needs and increasingly the rise in elder homelessness, but beyond that, the overall declining mobility as people live longer without adequate retirement savings. How do people afford aging? So I'm not going to spend all of our time going deep on each of those, but just to give you an example of one, we set a bold goal, housing for all ages and stages, have a person-centered statement about what our goal is to live where we choose as we age. The target is millions of new housing options. And a local model, we lifted up San Diego's work, particularly around making it easier to add ADUs, accessory dwelling units or in-laws, which can be very appealing for more affordable housing, for multi-generational housing, for caregiver housing, for downsizing as we age. So, and again, it's not just housing as you look at the strategies, transportation, outdoor spaces, emergency preparedness, and climate-friendly aging on wildfires and so much more. So I'm going to skip ahead because there's goal 2, 3, 4, 5, but just to give you a sense of the richness, and let's go to, I think it's slide 16. 2 other pieces I want to highlight for you, especially give you a heads up. A key part of this is a local playbook to engage local communities to take their aging work to the next level. And if we go to the next slide, the first step of the playbook is engage your local leaders. And if you have can see the small print, the very first local leader is local government. We know that local government is a key local leader in age-friendly strategies and age and disability and dementia-friendly strategies. So this is your friendly heads up that we hope you are hearing and will be hearing more from aging disability advocates and family caregiver advocates and consumers about engaging with the County Board of Supes and the range of county health, social, community opportunities, parks, rec, transportation, so much more about how to either start a master plan for aging for your community or leverage one you may already have through AARP or other age-friendly initiatives. All are welcome. And then the last piece I want to highlight for you is the data dashboard for aging. Next slide, which is our attempt to create a one-stop to get aging data and as much as possible for 2 reasons. One, to have the data tracking those goals that we lifted up and to do so in an equity-focused way with race and gender and LGBTQ where we have it so we can see, but really importantly by county. So next slide will show you just some of the data indicators that are available by county level in each area, lots in the health goal too, but also data from UCLA and other sources that talk about, look at goal 3, life satisfaction, community support, access to the Lifeline program, volunteering, and some APS data. So lots and lots of county data there, and we hope to only be adding to it. And just one more slide to give you a little screenshot. Let's say Fresno's County's here and wants to look at an indicator here on services here and information assistance services. This is what you could look at, is kind of to see where Fresno County is and how many providers do you have? How many is that per your population? So that's just the kind of thing you can do. We did a demo of this for ledge staff recently at the Capitol that was very well received, and hope your data people on your staff can dig in and find what they like, and also come to us with requests for continuous improvement. So last thing I'll say before handing it off is we don't want this to be one of those big, bold plans that sits on the shelf. We intend this to also drive action. So with those 10-year goals, we also released a list of 2-year initiatives, over 100 initiatives that various cabinet agencies signed on to work on in partnership with you all, the legislature, advocates, our new federal partners, and more. And again, I'm not going to go through all 100, but next slide. A few that we just picked out that might be of interest to you. Initiative 16 under housing. I can't tell you how many times I heard this issue out on the road back in the day when we went out on the road about paratransit rides not being able to seamlessly transport a rider across a transit district line. And having our elders and people with disabilities having to wait at corners to pick up the other bus. And so can we get some solutions around a seamless ride? Also the need to, our governor has included money in the budget in January for blue zones to work with public health departments to make a second round of grants after last year's Healthy Brain Initiative to do a second round around blue zones to expand dementia-friendly communities. So more to come on the budget and in partnership with CDPH. Let me jump down to goal 3. One of our top priorities at my department, CDA, is information about aging and disability. We are also proposed in the budget to go statewide with this no wrong door system. Some of you have it in Marin or Ventura, Nevada County, but it needs to be statewide, needs to be commonly branded, supported by great local partnerships with AAAs and independent living centers. And so very much needs to be closely tied to counties also as drivers of health and social services for older adults. And similarly, Initiative 101, many of you may not know that your Board of Supervisors sometime in the early 80s designated who your local area agency on aging would be and made a range of choices from within your county government at different places. And Shireen can talk more about that. But also with a nonprofit partner or a university partner to be your agency on aging. And so one of the questions that we are asking in light of the master plan is, should we revisit those decisions made in 1980 to make sure that we're all structured at the state and local government and private partnership as strongly as we can be. So more to come on that one, also deeply with CSAC. All right, I think my last slide just says more to come. Sorry, one back. We will be creating a new committee to oversee implementation, to advise us to continually improve and hold accountable. And we fully expect to have county participation in that, as well as reviving or reconstituting some issue-focused committees like long-term services and supports to really support home and community living, equity and aging, and a new elder abuse coordinating council, again, building on some of the work that counties have done in this area that we can learn from at the state level. So much more to come. As soon as we can get this vaccine curve behind us, you will hear more and more about Master Plan for Aging, but we're really excited to be continuing and deepening our partnership with counties. Thank you very much, Supervisor Griffiths, and hand it over to my colleagues.
Yeah, thank you so much, Director Mccoy Wade, and I'm sure we're going to have some questions for you at the end, so look forward to hearing that. Okay, now we're going to hear from Elizabeth Fuller, who will provide the legislative perspective on the master plan. So go ahead, Elizabeth.
Hi, hello everyone. Well, first I'd like to say that you are getting your second string here. I'm sorry that Session took the chair away from all of you. I know that he loves to partner and kind of do a roadshow with Director Mccoy Wade, and they were able to do quite a few over the spring and summer, but I am happy and would love to hear from all of the panelists. I am a staffer at heart. I've been a staffer in the building for a long time, and I would be proud to staff any of your panelists today. I think that they all make magic happen. First, I want to say that I think that counties are so important, if not as important as those who are making decisions at the state level. I think the closer you are to the people who live in your communities, you are seen, you are really boots on the ground quite often. And so the decisions that you're making and the policies that you work on and how you work really in between what happens at the state and in your local level, that's where the best work happens. And I think the best partnerships can really show when counties and their legislators work together. So relating today to the master plan, my first day as the chief consultant for aging was also the first day of the master plan meetings. And I was encouraged to attend and see who was there and what the meetings were like. And I have to say that I've said this so many times that this was such a robust process. I think I questioned my decision, quite frankly, of if this was the right job for me, because this is a world where people have given this their life. These are subject matter experts decades over. And it was really intimidating. But also at the same time, I think there wasn't a time during the master plan process that every person that was a part of the master plan wasn't willing to answer questions and really share their knowledge. It again, these meetings were 6 hours long, but also the countless hours that went into the homework that happened before the meetings even started. These are people who were really committed to a process that would drive change. And I think that when this pandemic first hit and how it hit seniors and people living with disabilities the hardest, the full pivot still followed suit exactly for that change. I think that you saw them redefine how they would meet, what they were going to meet on, and really to redefine the product that they were going to put together. And the product is still something that I think it looked different than what I had imagined it to look like, but it's still, the longer time goes on, the more I can go back to it and see it as a document, as a ever-changing complement to the work that's being done in policy. So one thing that I think all of this is showing, whether it's the master plan approach or it's the pandemic, that everything that we saw happen with COVID early on and over the last year, there is really nothing that was caused by this pandemic. It really highlighted an underfunded and underappreciated policy area. I think that there's nothing juicy about aging. It's not sexy. It's not often a desirable chairship, but the chair that you have now is not only committed to the work that he has ahead of him, but has actually made open statements that he has no desire to ever change, and he hopes that all of his time in the legislature will be in this committee. He encourages all of his colleagues to find ways to whatever is important in their districts to tie it back to aging. And I think that's really what the master plan has done, is when you look at these 5 areas, there's so much that's interwoven. And very early on, about a year and a half ago, the research that was done around how homelessness in Oakland impacted health. And it was a really eye-opening. Many people can say, well, of course, but the data that was there not only was, it was so compelling that housing has to be a part of health as we move forward. But also all of the other pieces of the master plan, when you talk about inclusion, and if you're not getting information out for people, it goes right in line with the no wrong door approach, is that people receive information and enter systems in a variety of ways, and we have to be able to identify that. And also everything relates back to caregiving, that when we are caregivers and the support that we give to caregivers, what that looks like. And that happens in different ways in different areas. That happens because people work in spaces as caregivers, and we need to recognize that. And there are other spaces across the state that these are family unpaid caregivers, and what type of support do we need to give there? It is a big issue for the chair that we look to how all of us can age well. How can we all afford to age well? And that should be happening, that as soon as we hit adulthood, what are our plans to age well? So I think that all of the 5 areas in the master plan are certainly things that when I sit down with the chair and we're talking about policies that are before us, and those really range. They're all over. We have bills that are before our committee coming up in the next month as policy committees start to meet. We have bills that are around healthcare goods. How are people accessing these items that they need for their general health and wellness? What does mental health look like for those that are aging? Expanding PACE. For those that are fortunate to have PACE in their areas, in their counties, these programs, in my opinion, are great programs. And how do we find ways to better educate people about their availability, but also recognizing what allowances were identified during the pandemic, and how do we ensure that those are solidified moving forward post-pandemic. Financial abuse is an issue that we're always looking into. We just did a big webinar with a town hall with AARP and the treasurer, Fiona Ma, really identifying the different ways that people are abused financially, whether it's really meant to be a scam that's kind of a wide net, but then also what happens when it's closer to home. We have some bills that are coming forward. I've just seen amendments on today about our CFEs. I think that we have lots and lots of bills that people are trying to put forward about how we make sure that seniors have technology, and how is that reaching this population. We also have a bill that's authored by the chair around housing, and how when you add an RN as part of a multidisciplinary team in affordable housing, it has actually shown, there's data that's shown how people are able to age in their space longer. Dr. Pan and Assemblymember Nazarian are working a bill in tandem. They each have a bill in each house, but we're working at lockstep around long-term support services benefits, and what does that look like as we try to plan. But I think that if I were to identify what the legislature is doing right now that will be the most impactful for seniors, that's the budget, and that's the subcommittees are starting to meet now. We have quite a big budget hearing coming up this week. But what are our big challenges this year in the budget? I think last year, this is an advocacy group around seniors that works like no other. They really came together after some cuts in the May revise, and really identified spaces that even those that were calling in were saying, I realize that I may see cuts, but you can't cut this program, because this program, while it doesn't directly impact me, has the greatest impact on seniors. And we didn't really toot the horn because it really wasn't the time for it. But aging did very well in the budget last year, even during a time of really significant cuts. But the chair of aging put in 12 budget-related requests. We had quite a few letters that we sent in, and they relate to data collection around LTSS, asking for money to update the application for CalFresh. As we know, seniors, California ranks last in enrolling older adults, and only 19% of older Californians are enrolled in CalFresh. And this is not pandemic related. This is the 20 years experience that I have in the legislature, and that is that oftentimes it's the paperwork. that keeps people from being properly enrolled in a program that really could be life-changing. We put in a $75 million request for senior nutrition. I think that of something that we can all be the most proud of. Shireen is on after Kim. I think that we saw people who deliver nutrition to seniors come out, and if you're talking about heroes, this was really identifying a need, completely changing the model of how they deliver. And so for those of you who are able to help support how your counties were able to serve seniors, this is a big ask, but one that we think is needed. We have support for what's already there for the MSSP continuance, as well as caregiver resource centers. The family caregivers and what they do in the state of California is just incredible. And it needs to continue to see the benefits that were promised from years past come to fruition, because the needs for family caregivers right now are greater than ever. We also have some continued support for what was identified relating to Alzheimer's in the budget, but also others that come forward that were really related to how we make sure that those living in skilled nursing have access to making sure that they have resources if they need them. I think that's something that came up during this pandemic and in tandem with the Master Plan on Aging was what we need to do relating to skilled nursing. And some of that is workforce issues and also just kind of identifying how do we become more current in oversight. But that's really relating to the budget, where I think that that's our greatest impact as a legislature. I do want to say that I didn't know that there's going to be a continuing stakeholder committee with the master plan. So I learned that from Kim, just in what she was saying previously. And I think for someone that works in this policy area, that's really a balm to my work. And I look forward to continuing the work with counties, but also everything that just really supporting everything that the master plan has. So thank you.
Thank you so much, Elizabeth, for joining us, and thank you for your leadership on this issue. And please thank Assemblymember Nazarian for his leadership, and I look forward to continuing to have CSAC work with him. That's really great.
Thank you.
So next, we're going to hear from Shireen McSpadden, who's going to give us the county perspective on the Master Plan for Aging.
Great, thank you, Jeff. Hi, everyone. It's really great to be here amongst some real stars in aging services world in California. And of course, we know that a lot of what happens with these types of programs and the way to move forward is often at the local level. One of the great things about the master plan is it really allows localities to kind of script the way that they want to do some of this stuff. And Kim mentioned the local playbook. Rashina, if you just go to the next slide. Kim mentioned the local playbook and kind of walked through it, but I want to just give some examples today of things that we're doing in San Francisco to use this local playbook and really socialize the master plan with our local leaders and with older people and people with disabilities in San Francisco. So just showing this one slide to remind everyone, Kim kind of did walk through this, but it's really kind of gives you a way, gives each county, in this case, a way to walk through the master plan and think about ways that you can use it within your own locality or county. So next slide. So play one is to use the governor's blueprint to engage your local leaders. And so one of the things that we've done in San Francisco, and I know a number of other counties have done the same thing, is host events and discussions with local elected officials and stakeholders. So in September 2019, which was early on in the master plan planning process, San Francisco's Long-Term Care Coordinating Council hosted a widely attended event in partnership with the California Collaborative for Long-Term Services and Supports. And it was really great. I mean, I believe we had about 300 people in attendance, and it was kind of the first time in San Francisco that we got to talk about what this plan could mean for San Francisco. And it was also a chance to bring people together across sectors. One of the great things about the governor really taking this seriously and showing such leadership with this master plan is he's kind of said everyone needs to come together across sectors, because aging happens everywhere. It doesn't just happen in the California Department of Aging. It doesn't just happen in the Department of Disability and Aging Services in San Francisco. It happens across sectors. And so our coordinating council is a group of people in San Francisco who are focused on long-term supports and services and making sure that our long-term care system is really thinking about people's needs across the spectrum. So we have people from health, from aging services, we have CBOs, we have people with lived experience, both in disability and aging, people who are consumers of services. And it was really nice to have all of those people come together and really talk with our local leaders, both at our local supervisor level and then also our state reps who were also there to present and to hear from people. It was really nice to have that kind of big kickoff. We are going to be hosting another event. I thought it was going to be in April. Fortunately, it's not, because we're not ready for it. But we will be hosting another master plan event this year in conjunction with the California Collaborative for Long-Term Services and Supports. And we'll be focusing in on one of the goals and some of the strategies. So the 5 bold goals that Kim mentioned will be the topic, or one of those goals will be the topic of our big event. And it'll give us a chance, again, to invite stakeholders throughout San Francisco to share their thoughts and opinions so that we really have something to work for as we move forward. And then engaging state representatives through our state associations. So many people on this call are involved in CSAC. There are also people, I think I saw some names of others. So California Area Agencies on Aging is represented here, California Welfare Directors Association, Public Guardians Association, et cetera. It's really great to engage state reps through those state associations. And again, aging happens everywhere. And so it's nice to really think what can these state associations do with partners like Assemblymember Nazarian, like Liz, how do we engage on that level and really think about what we need to do to move forward, whether it's legislation or budget initiatives. And then the third thing that we're doing locally is really sharing and presenting on the master plan to local leaders. I know I've been involved in a number of presentations locally just to talk about how we can use this master plan process, what it means for San Francisco. And, we can't do that enough. We've had a lot of interest in it, and we also have the ability to get people excited about it. And, so they have to understand the various elements of it in order to really engage with it. So that's an opportunity, I think, for every county in the state. And the next slide. So I just kind of took the goals here because I'm not going to go through every play of the playbook. Some of them are fairly self-explanatory, but this one really made sense. And I just wanted to give some examples. So select your master plan initiatives for implementation. And so housing for ages in all ages and stages is very bold because of course we know we are short on housing in many counties. And also we don't have housing that allows people to choose what they really need. And it doesn't allow for people to always live at home, age in place when they want to. And so there are a number of strategies under that goal. But for us in San Francisco, one way that we've engaged with that most recently is that our Board of Supervisors voted to have the Department of Disability and Aging Services oversee a report process on affordable housing needs and the supply pipeline with local housing planning and disability agencies. And so our department is the lead agency for this. And what we're now tasked with is doing a report every 3 years that tells our city where we are, where we stand with respect to senior housing, where we stand with respect to accessible housing. And we don't even have that in one place right now. But once we have this report, and we'll be reporting to our Board of Supervisors every 3 years, we will now know where we stand with respect to senior housing and accessible housing for people with disabilities. And it's a big step forward because it means that once we have this, we'll be able to plan for those needs. Second one is Health Reimagined. What we're doing locally is exploring opportunities for health plans and partnerships. And that really means working with health plans to see if there are ways that we can kind of pull together area agencies on aging that are tasked with planning for the needs of older adults and kind of marrying that with what health plans are doing, really thinking about outcomes for people and using the network that we already have. Kim mentioned, I think early on, nutrition services, things like that. Really thinking about the network we have and the services that AAAs provide, and figuring out whether we can find good partnerships and alignment with health. So I just wanted to give, I know I don't have a huge amount of time, I wanted to give you those examples. We're certainly working on the other ones as well. And then just to move to the last slide, it's finding ways, not the last slide, this one, finding ways to, and opportunities to integrate the master plan into processes that already happen. Area agencies on aging are also tasked with putting together area plans every 4 years and then updates every year. That's something that we have to give to the California Department of Aging. So there's certainly ways to build that into the plan there. A number of counties and also cities and other municipalities and rural areas, even in California, have age-friendly initiatives. And the master plan really can complement those activities. So thinking about ways to build some of these master plan elements into your age-friendly and livable cities initiatives, and then other strategic planning processes and materials. I think we all have a number of plans that we build and develop. And so it's really about thinking about how to use those master plan elements and putting it into those local plans to ensure that older adults live and thrive in the best way possible. And I think that's about it. So thank you, Jeff.
Okay, thank you so much, Director McSpadden. That was really great. And thank you for your county leadership with the master plan. And so our final panelist is Kevin Prindiville, who will provide key insights from the aging stakeholder community about the master plan. So go ahead, Kevin.
So hello, everyone. Wonderful to be here with you today. Thanks for having me. And again, as others have said, it's really wonderful to be with such a remarkable group of colleagues. I'm Kevin Prindiville. I'm the Executive Director of Justice and Aging. We're a national nonprofit that does legal advocacy. We use the power of law to fight senior poverty. And we're national, but we have offices in California. So we do both California state policy work, federal policy work, and then we work with advocates and providers and families and older adults all across the country, really helping to ensure that low-income older adults in particular are connected to the services and supports they need as they grow older. And I've been very involved in the Master Plan for Aging stakeholder process. I was a member with Shireen of the Stakeholder Advisory Committee and have helped lead that group to engage in advocacy around the master plan, as well as other issues that have come up in the last year, as others have highlighted the particular impact of COVID on older adults. And I'm going to share just a few reflections on I think, where we are with the master plan for aging, what's good about it, what the opportunities are in front of it, and how counties can be involved from a stakeholder perspective. But I first want to add just a little bit to where Kim started with explaining why we needed to develop this master plan for aging. And we're certainly grateful that we have a governor who acknowledged that need and worked with us to develop this. And I think from a stakeholder perspective, there's been a perception among many aging advocates and service providers and also disability advocates and disability service providers that issues of aging and disability don't often get the attention of policymakers, especially at the state level. I think the closer you get to home, the more attention is paid to issues of aging. But I think at the state level, at the federal level, there's this sense that we've been underprepared. We've been slow to respond to our existing needs, our evolving needs, our growing opportunities as the demographics in our state shift. And so we needed this master plan to really start to draw more attention to and begin to identify what needs to change about our systems to be ready for the needs that our families are experiencing today, as well as the opportunities that older people offer in our communities. And I think this last year just really clarified that and confirmed that for us as we saw COVID's particular impact on older adults. You know, I don't think we were ready. And I think we see a lot of opportunities to reform and rebuild as we recover from COVID. And we think about how COVID in particular impacted older adults and our families. So the master plan for aging, I think, sets us up really well to do that. In particular, I think the plan accomplished three things. First, it creates this framework that Kim shared for organizing work across so many different stakeholders, you know, state government, county government, advocates, service providers, private philanthropy, and even corporations, that they can engage in these common 5 goals, which I think are the right high-level goals that Kim went through: housing, health, including long-term care, inclusion and equity, not isolation, caregiving, affording aging. I think that what was captured in the master plan really reflects you know, the core needs of our community as we grow older. The next important thing I think the master plan did is that it really takes a whole of government approach. That it didn't treat aging as just the job of the Department of Aging or of one agency or one department, but really looked at aging, which is impacting as something that impacts all of us. It impacts our entire families, it impacts our entire communities, it impacts our counties, our state. It really needs to live across everything that we're doing as governments and as a community. So I think that's a really positive thing the master plan accomplishes, taking this, every agency has some role to play in how we address aging in our state. And then finally, it identified, in addition to setting these goals, it identified particular commitments that this administration is undertaking to advance the goals. And that's laid out in all of these particular initiatives, over 100 initiatives. Some are big and bold, some are the next step, but everywhere we're talking about specific initiatives that will be undertaken that help move us to those goals. So I think those are the 3 critical things: the framework, the whole of government approach, and specific initiatives that connect to the goals in the framework. And I think that this is going to be an effective strategy for improving the experience of aging in California. First, because the framework was really developed with such significant stakeholder involvement. There was over a year of stakeholders putting topics and ideas on the table and then thinking about priorities among those topics and issues. So the framework really reflects the priorities of stakeholders. And so in this way, I think the Master Plan for Aging did a lot of homework for work that counties do next. Because I think as you reach out and work with stakeholders in your counties, I think you're going to hear a lot of the same themes that are in the goals of the master plan. You're not going to hear, there's not going to be a lot of surprises as you talk to people. So I think that the master plan gives that kind of set of goals and a framework that are the right goals and really reflect a lot of stakeholder input, so that part of the work is kind of been done ahead of time. And I think if this process is going to continue to be successful, that ongoing engagement of stakeholders is going to need to be critical to make sure that the plan is actually successful in implementation. As we think about our work at Justice and Aging and with partners across the state, we're really thinking about how we hold the administration accountable and how we help the administration actually move forward as many of these initiatives as possible. So as Liz talked about, there's just a tremendous amount of energy from aging and disability stakeholders to really continue to be engaged in this work at the state level. And so thinking then about what that means for counties, I think that as others have talked about, there's a real critical role to play here. And I think, fortunately for counties, you're going to see a lot of energy and excitement from the stakeholders in your counties, building off the master plan to now engage with you at the county level to also move forward on this framework and these goals. And you heard others talk about the local playbook. I think it lays out really well the steps that you can take at a county level, highlighting, engaging the local stakeholders, using equity as a real primary lens for which you view and analyze the issues in your county and then create initiatives to respond. I think there's opportunities for counties to coordinate with specific state initiatives, and also opportunities for counties to develop some of their own initiatives. I do think it's critical that counties also employ this kind of whole of government approach, but I don't think in a county you have to try to take on all 5 goals and all kinds of initiatives. You know, you might find energy in particular on housing, or in particular on elder justice, and you can really use the master plan, what it has on those topics, to drill down and do even more in your county. And then the last thing I wanted to highlight was the opportunity for all the counties to be learning together and suggest maybe there's some type of learning collective or collaborative where the counties can be reporting on what you've done in these areas and just learning across counties for what was a great idea, what didn't work, what would work that could translate from one county to the next. So I'll wrap up there to save at least a little bit of time for questions, but thanks for having me.
Okay, thanks. I really appreciate your efforts as a stakeholder in this process. So thanks a lot for that, Kevin. So we have a few minutes left for questions, and the first one I'll throw out to Director Mccoy Wade, but any of the panelists can feel free to give their thoughts on it. You know, this is a very ambitious plan, a 10-year plan, and has numerous initiatives for the first 2 years. And we know that we can't eat the whole elephant at once, that we gotta pick some things off. So my question is, what are a few things that counties can do in the next few months to start off? And maybe as an addendum to that, you know, I think there's been some really great initiatives that have come out of the pandemic by necessity, and some nimbleness that I know that at least in my county, we've had our aging services folks been doing some, you know, really interesting and innovative things. So how can we capitalize on the success of what we've been forced to do in the pandemic, and what sort of steps can counties take to start chipping away at these initiatives?
Sure. Well, I can share. That's kind of the same conversation we had in the governor's office as well about 3 months ago. How do we eat this elephant? And so here's the approach we came up with. One is layering aging into what your county's top priorities are already. If your county is already prioritizing housing, if your county's already prioritizing climate, if your county's already prioritizing rethinking criminal justice, there is an aging component to that. So I think layering aging and bringing your aging experts into what are already, so your demographics are informed, your trauma informed, you're informed about the legacy of racism in our elders and also their cultural gifts. So aging goes into what you're already doing, first of all. And then the second thing is I would pick a few places where you can focus. For us at the governor's office, one of them was, we have to get this front door up so the public can find information and assistance about aging clearly, consistently across statewide. That's one of our top priorities. But also Alzheimer's is a huge, and helping prevent, identify, diagnose dementia. And then we're also looking to create a new office of Medicare, because there's so many opportunities, particularly with the new administration on Medicare. So some combination of layering it to your big priorities already, and then a few targeted priorities is how we're trying to approach it. And I couldn't agree lastly about the pandemic. Your nutrition expansion, whether it was with Great Plates and your Meals on Wheels and food banks and agencies, I think there's a huge both potential cliff coming as federal funds go away, and also opportunity to work in new ways. Can't say enough about Project Home Key and how we use those models to stop. We were very proud that the calls for an end to homelessness among older adults, not a reduction, not an end. So I think there's opportunities there. And then I think we've all learned a lot about our neighbors who live alone. And how can we've had to reach out for stay at home or reach out for the vaccine, but how can we make that the new normal and stay connected, whether it's in person or internet, so that people are fully engaged in our community in good times and tough times.
Great. Does anybody else have any thoughts on that? First steps that counties can take? Okay. So Director Mccoy Wade, do you think that there will be some resources from your department to give presentations to boards of supervisors or ways to kick off the conversation?
Absolutely. We always want to do that in partnership with your local aging leaders in government and without. But yes, we have a project director, Amanda Lawrence, who is the brains behind our local Playbook effort and is always available to you. And in fact, we just got an invitation from, I see Kim Gallo on the line from San Diego, from the San Diego Foundation. So happy to engage there and elsewhere.
Okay, wonderful. Thanks. So the next question is for Elizabeth, and Assembly Member Nazarian has mentioned wanting to raise the profile of aging issues within the legislature. I've heard it said that it's always everyone says it's a priority, but it's the fourth or fifth or sixth priority that seems to never quite make it into the top tier. So how can counties support that effort to increase their legislators' awareness and interest in aging issues?
Great question. I think that, yes, legislators were encouraged to have 12 bills to move during this legislative session. And I had countless meetings in January and early parts of February. And when bills were introduced, it was clear that aging bills were the 13th bill. Very clear that how many bills were coming down and ideas, but how many actually made it to someone's bill package. I think I couldn't agree with Kim more that if you are constantly finding ways to connect, right now, technology is being talked about constantly, but it's being talked about because of how our children are going to school. And that has everyone supporting expanding technology, expanding access to technology. This doesn't need to be a senior discussion. This needs to be a discussion that we say, and in addition, if we were to expand technology and ensure that all of our school-age children have access to technology that's affordable and reliable, this would also then change the isolation that seniors feel, give them greater access to telehealth. And it's something that's an add-on, but you already have people who are championing this issue. So I think sometimes you may come forward with an idea from a county level, and it seems like an enormous lift. But when we've already identified that things are happening in this space, it's not such a big lift. And I think that we could identify that, in all sorts of spaces. When we talk about housing, how do we end homelessness or housing issues for seniors? It's a really big issue. There's a lot of work that's already being done. So how do we either make it something that we can use many legislators to push an idea forward? That's something that I think gets a lot of traction. Or we can take bills apart. Don't make them so big, but we can take them in pieces and have several legislators carry pieces that move kind of a platform forward.
Great. Thanks for that answer. Okay, so question for Director McSpadden. County aging structures, the coordination of services and the programming and the way programming is delivered varies so greatly throughout the state from county to county. What are some key advances or areas of focus that all counties can move forward on, and how can the master plan support those efforts?
Well, I think I think all counties can really move forward with the 5 bold goals and really think about what it means to house people who are older and how to set up those plans, what it means to think with an equity lens, certainly how to think about integrating healthcare with aging. I mean, I think those goals were made specifically for that reason. They're bold, and yet they're actually very tangible things that people can do. And part of the great thing about them is that every county is different, and it really can use those goals to focus on its specific populations, build on things that it's already done. So asset mapping is a great thing to do, and it's part of age-friendly communities. So really thinking about what you're good at, what you've already started, and then where the gaps are in those 5 areas is just one way that every county can engage with this work, I think.
Okay, great, thank you. And finally, a question for Kevin. I know in my community that the pandemic has highlighted both challenges of isolation for older adults and also brought out a tremendous spirit of caring and volunteering and innovation in the way that we care for our neighbors. So from the advocacy side, how can we build on the momentum of both the challenges that we've identified and maybe problems that have been invisible and we haven't seen before, and maybe some of the solutions or greater sense of urgency that we've seen from our public on caring for our elderly neighbors?
Yeah, well, that's a great point, Jeff, and certainly something that has been encouraging through all this is the sacrifices that people were willing to make, and recognition that it would protect the health of many of the older people and their families and communities, and the way that communities have come together has been very positive. One area in particular that we feel like this is just COVID is the call to action that we need to respond is around our long-term care system. And that we do have opportunities at the federal level and the state level and in local counties to really reform our long-term care systems to try to support and keep more older adults at home, connected to family, connected to community. COVID showed us that that's a safer place for people to be. And like you said, created some new ideas and new ways that that we can come together as families and communities and neighbors to support each other. And there's obviously a lot that needs to happen at a federal level around a long-term care benefit and at a state level. But I think counties too have a lot of work to do. Some, like Shireen was talking about, like begin to understand in your county how the system of home and community-based services operate, mapping what you have, what's missing, how you could start to fill the gaps, how you could recruit state funding or federal funding to start to build new systems, because the more people that we can keep at home and in our communities, the better served older adults will be, the stronger our workforce will be, the stronger our economy will be, and I think the happier and healthier our families and neighbors will be.
Okay, great. Thank you so much. So it looks like we made it right around 3 o'clock. So I appreciate everyone taking the time, and I want to be respectful for everyone's time and wrap it up. I want to remind everyone it's really easy to find the Master Plan on Aging. Just Google Master Plan on Aging and it pops right up, and there's a wealth of resources on there to get us all started on this process. And CSAC is going to have continued opportunities to engage with this. Our staff, particularly Justin Garrett and Rashina Duree will be engaged ongoing throughout this process. And if anyone on the call has any questions or needs connection with one of our panelists, they can feel free to reach out to Rashina or Justin. At our legislative conference for CSAC coming up on April 21st at the Health and Human Services Policy Committee, we're going to be joined again by Director Mccoy Wade, so we can have another chance to discuss this. And I believe that the recording of this will be available on the CSAC website. And I thank everyone for joining us, and we'll get to talk about this again soon. So thank you. Bye, everyone.